The January 2005 publication of Delivering Race Equality in Mental Health Care, an action plan for reform inside and outside services, heralded a new way of working within mental health services. This combined the recommendations of the Blofeld Inquiry and Delivering Race Equality in Mental Health Services, along with 12 characteristics to action plan against. Armed with ministerial backing and a national program team to oversee its implementation, strategic health authorities were requested to submit focused implementation site bids. South Yorkshire was one of 17 sites chosen. CIFES has been focusing upon 3 building blocks, and these are: better information. Through improving monitoring of ethnicity data, better dissemination of information and good practice, as well as improving the knowledge base of effective ways of working. Appropriate and responsive services. Through improving organizations and their workforce, ensuring clinical services are enhanced to meet culturally specific needs of BME communities. Community engagement. Through developing healthier communities that are engaged in the planning of services and that are supported by community development workers.
I was initially involved in South Yorkshire FIS as the Chief Executive of Sheffield Racial Equality Council and also South Yorkshire Race Discrimination Service when the programme was initially set up. And as part of that, we with our workers were very keen to see the programme roll across the whole of South Yorkshire because we had grave concerns around issues of cultural intelligence and competence and in terms of racism and discrimination and inequalities within the mental health field.
It doesn't matter to me whether you are black, you are white, you are female, you are male, what your sexual orientation is, what your race is, your creed, your religion. You have the right to access services as anybody else. And my job is to make sure people have got those equal opportunities to access services.
Basically, I knew nothing about mental health. I didn't even realize that what I was going through was a mental health issue. And I realized that in our culture, there's a stigma attached to mental health. And I wanted to break that stigma. I wanted people to understand that actually you don't need to be institutionalized before you can call that mental health. So that's when I joined the Women's Forum. And I know I'm focused only on women, but it's gone on to empower women to help in their family life as well.
How I can set up forum was I consulted all the BME groups in Doncaster. Then I set up what I call a reference group. That reference group combined professionals from health authority, from local DMBC, local government, from some voluntary organizations like Edge Concern, and some BME community groups as well.
Our main work within the Doncaster Focus Implementation Site is about trying to change culture, trying to change attitude, which will in turn change behaviour. One
of the areas of concern for us was to ensure that white minority ethnic communities were also part of the process, particularly the Irish community and the Gypsy, Roma and Traveller communities. As you know, Trevor Phillips had highlighted that the situation for Gypsies and Travellers was incomparably worse than for any other minority ethnic community per se, and that there needed to be severe action taken and inequalities and discrimination redressed.
The crucial things that needs to be done is to engage clinicians in this whole process. We need to engage all the other clinicians within the trust to support the project, and hopefully in that way we'll be able to improve the experiences of BME communities in all the wards in Sheffield, as well as within the wider community.
Across Yorkshire and Humber, we've got to see this work being pursued by all the other PCTs and other providers. And that's about ensuring it sits at the very, very highest level as a priority. And I think the work that's been put in with the collaborative of PCTs and providers in mental health services is a fantastic start. We just need to make sure that carries on all the way through to see the real evidence on the ground so that patients feel a real difference.
It's about tapping effectively into the expertise and experience which exists within communities and making use of that to improve services.
Having clear and transparent plans and targets from a hospital perspective, so people can see what particular targets we're working on, how we're going to work with people in the community to ensure that those targets are particularly met.
I think mainstream is the key issue, because if you don't do that, it becomes an interesting pilot that did some interesting work, And I think that is about organisational commitment. And I think if you don't give a clear organisational commitment from the top of the organisation, then it will fizzle out. We will not let this fizzle out. We're already doing a lot of work in terms of training more and more staff in improving their cultural competence. And we're on to the third of these improved access projects within the organisations.
End of the day, we're talking about people, people's lives, real emotions. And to be able to help someone where you can give them the confidence and empower them to move on, there's no real better feeling than that.
I guess the biggest message I want to give from this experience in particular is the commitment from the partnerships really to drive this agenda forward. It's not just been seen as a health agenda, it's been seen as a social inclusion agenda.
Now we have real events with people that we're really getting to know. With 200 plus people at an event, it's magnificent. We can actually feel that we are reaching the communities and really getting the views of the communities.
It's about involving our patients and the public and communities. It's about true partnership. It's about involving clinicians. And probably very importantly, it's about using information and data. So if you take all those component parts, that fundamentally is what we're seeing in South Yorkshire FIS. And we just have to have more of that across the whole of PCT's commissioning.
The additional benefit that's been accrued is that we've been working with the Sheffield Care Trust and the PCT in Sheffield, and now we have got a social agreement with the PCT to roll this out in the mainstream. So we can they've actually given us a contract now. We've been employed advocacy worker who will go out and work within the community, work within the hospitals with the GPs to address the issues, and that is the way forward. And that's something that should happen throughout the UK.
It's given me so much confidence as a person, as in my everyday living, as a mother. You know, I've actually come in leaps and bounds.
It creates a lot of friendship. Since these people are isolated, you know, it is the only opportunity they can come together and discuss their unique problems. Since they are a minority group in the country, they have unique problems which they can't express, you know.
The level of social isolation has changed, and he's changed the attitude towards how people looked at him. And he said that he's been valued as a patient, not just someone like a burden to the society.
One of the positives that actually came out of this research is that we recruited 2 health workers from within the GIPS traveller community. Out of the 5 researchers that we actually recruited, they also went on to either further education or employment.
We also found that the awareness of the community was also quite low in terms of accessing services. So the programme has also actually worked directly with the communities to encourage them to use the services required.
Our Respecting Diversity in Doncaster strategy should be complete by March 31st, 2009, which ties in with the South Yorkshire Focus Implementation Site coming to an end.
The DRE framework is now embedded into all our structures, and particularly in the subject areas that I work in, where we're in different commissioner hats, if you like. The next steps for me is using the learning from the SIFEs to transfer into drugs and substance misuse.
The main thing is about invest to save. We have to invest in the community or the community organisations, so therefore the health service can actually sit on the budgets.
This is about world-class commissioning, and I think South Yorkshire FIS is a great example of good practice. And we want to use this sort of approach in all that we do.
It has not been easy. I, more than anyone else, knows the kind of territory that has had to be negotiated in this region and elsewhere around the country. But people like Sora have stayed the distance. They've made sure that the work stayed on track. And for that, I'd like to give a big vote of thanks and to wish the work well and in the future, and also to wish Sora well in the future.
Over the last year of the SIFEs demonstration project, we have been working hard towards building